All right, because we know we are in nails, chapter 6 of this cosmetology, page 113. We're in the study group today. We know that on our Tennessee State Board, we do have nails on there, particularly in skin analysis, disorders, and diseases. Okay. Yesterday, we're going to have a brief overview and bookmark, a highlighter for this as well. Yesterday, we had an intensive discussion on disorders and jumped into diseases of the nails. Brought back a lot of memories. Today, I just want to recap and just kind of finish it off. And so, any questions, please jump in the chat or text me or just unmute if I don't answer. Okay. It says, how can you have a thorough understanding of nail disorders and disease? Because, and here's the thing, every top of the chapter, you got to find out why you're supposed to be learning this. How important is it? You need to identify these things, okay? Disorders can be treated. Diseases are not to be serviced in salon. We always have to stay more factor. And remember, Tennessee is heavily infection control forward. So anything about spreading something from one person to another, that's going to be a no-go. It's gonna open up a major red flag. They're gonna blow the trumpet. They're gonna bring attention to it. And so, if something looks abnormal, you must say something. Okay, and it's not about I need to make this money today. It should be about I cannot jeopardize my license because they will come for it. Okay, they just do not play about you spreading or being a part of the spread of bacteria, germs, microbes, infections, things of that nature. It's called infection control. So they're trying to keep it down, trying to keep it controlled. There are many instances all across the country where salons, pedicure spas, barbershops have been the focal point of where things spread within a community. Okay, and we don't want to have those focal points. It could lead to us actually getting our businesses closed down and our license restricted. And so we don't want to do that. Okay, we got to recognize the conditions. Okay, we got to recognize the conditions. It may be signs of serious health issues. Okay, whenever you see something, you're like, hey, we can't diagnose, but look, I think you need to go check this out. I think you need to go see a physician. Okay, as a cosmetologist, now that we're talking about nails, feet mainly, you need to have a podiatrist. You need to cross market with a podiatrist, okay? And we can send referrals there and it can send referrals back to us. You got to acknowledge the infectious conditions, the ones that are spread communicable, the ones that are go from one person to another, okay? That's easily moved around. You have to recognize that. You need to know how they look. You need to know the signs of infection. Also, it talks here about unhealthy nails. Honestly, if you know what a healthy nail looks like when you see something that's not supposed to be there, boom. Okay. That's what we need to acknowledge. Okay. An unhealthy nail. Okay. Okay. Now, here's the thing, we cannot diagnose. Our license does not tell us to diagnose. Okay. Treat, prescribe, or work on unhealthy skin or nails. That should put a button in somebody's bucket right there, because we don't do that. Okay, and anytime you find that people are disregarding just the general regulations, that needs to be a warning sign. They don't care, and they're part of the problem of spreading the bacteria, microbes, and infection throughout the salon and in their homes and small communities. Okay, so these individuals that don't care what clients have coming on their hands. Could be fungus, it could be anything in their nails, around their skin of their nails, and they sit down and let me go ahead and put acrylic on there. You have to beware. That person cares nothing about the well-being of your family. Period. Now, this order is to bookmark because this is an area I want you to come back and look at. I also want you to define nail disorder. It's an unhealthy nail condition that is hereditary or caused by injury or disease of the nail plate. So nail disorders could be the side effect of what really going on. It could be the latter effect of what's really going on when it comes to the nail unit. It could come from heredity. White spots, dark spots in the nail, melanated spots in the nails can come from your just DNA backup, okay, background. And then when it comes to injury, being careful, we're not closing our hands into anything, we're not jamming our hands, we're not, damaging our matrix area with that soft, fatty tissue. It's not even the nail yet. When we damage right under the cuticle and epinecium area, well, that's that nail fold. If that damages, we're gonna have problems with our nails growing. Nail may grow out shattered, but the nail may not grow out at all. So after about 6 months and the nail has not come fully back in the way it's supposed to be, you're probably gonna have an issue with that nail for a long time, okay, or forever. It says a client whose nail or skin is infected, inflamed, broken, swollen should not receive salon services. Here we are again, including ingrown toenails. So we have to, even though we could be doing the service, you have to understand again what's our scope of practice. Podiatrists are the ones that really deal with ingrown toenails. They do have a medical professional that you can get between a licensed manicurist and a podiatrist. It's like a study of pedicuring, so it's very in depth, just like with trichology, the study of hair. And so, having contact with those individuals who are highly skilled and certified, that's going to be awesome as well for you to just have the information. So yesterday we did an overview of nail disorders. We talked about bruised nails, abused nails, discolored nails. So these are some could be done by hereditary. Hereditary could be injury and could also be just the side effect, the recovering effect from a nail disease. Okay, these are some disorders most frequently encountered. All right, please make sure that we review these on the way. Um, Onychophagy, that is a long name, okay? But it just simply means bitten nails, okay? How do you get your clients to stop biting your nails? A lot of times it could be from a habit. You can discuss with them about things that they use to relax and regulate them. And so chiming into their senses, quiet time, soft music, things that you know that would normally relax you, it may relax the client and stop them from biting their nails. Okay. Uh, Onychorexis, irregular split or brittle nails, just dry again. If the hair is dry, the skin is dry, you probably got dry nails, and that's onychorexis. Once we do paraffin dips, you can do oil, you can do massage, just different things to stimulate, increase your water intake. You should start to see this really come and correct itself. That pincher nail, pixelated nail, those hard side walls, the free edge where it pulls over and rounds over into the skin and cause bruising, cause the plate of the nail to curve into the skin, similar to ingrown, like you would do an ingrown toenail, but you have it on your finger. Okay, and then you have ridge nail, of course. As a person ages, I talked about as you lose elasticity, you lose collagen, but as you age, different things in the body, they start to diminish, like your fatty tissue, your muscles, things of that nature. And so we want to start now on taking our vitamins, our collagen, exercising. So all parts of us as we age are in good condition, including our nails. Okay. And of course, splinter hemorrhages where we can identify that there's some type of blood underneath, and usually it's damage to a capillary. Okay. Usually it's damages to a capillary. And then we also have, and of course, average healthy nails. Okay, let's look at nail infections. I'm highlighting infected nail, visible redness, pain, swelling, broken skin, or pus. Those are signs of infection. So that's what you're looking for whenever you first come in and looking at someone's nails before you do a manicure or any kind of nail service. Redness and swelling are signs of infection. Okay, here's the thing: signs of infection could be on the scalp, could be on the face, the body, could be anywhere, nails. You always will look for signs of infection. These signs do not change. Redness says inflammation. It also will tell me there's pain there, there's swelling there, there's broken skin with pus. It says redness and swelling. What it does not say is local fever. You feel heat. That is also a sign of infection. Believe it or not, your test actually talks about, or is it an esthetician test, washing hands. So please make sure you go and watch the hand washing videos in the chapter and see. Watch the hand washing videos. Check out 6-2. Don't take any shortcuts. You're definitely going to use your soap. Wash your hands, and you always, after you wash your hands, hand sanitizer, apply your gloves. Okay. If you are touching something other than the client, you have to remove those gloves. You cannot be scratching yourself, your head, touching your face, and going back to the client. You need to apply hand sanitizer. If you move, if you touch the trash cans and things of that nature, you definitely, if you're touching trash cans, you definitely need to remove those gloves, wash your hands, and apply hand sanitizer and re-glove. Okay. When it comes to these utensils, you're going to wash the utensils always first with soap and water. And you just put some soap on the brush, get the water, and then you're going to brush your implements. Okay. Once you do that, you'll rinse, and then you'll set them over in the barbicide for whatever the instructions, however long it tell you to set it in there. You're going to pull the stringer up. It's going to expose the tool. You're going to go back and rinse it off. Once you rinse it off, you're going to dry it in all the crevices, and then you're going to put it in an autoclave. The autoclave or the dry heat sterilizer is going to kill all the leftover spores, so germs cannot grow again, cannot have any life to grow again. Once that is done, you're going to put it in a Ziploc bag, or you'll put it in a container, closed up and ready for when you need to use it again. You'll never put your tools in a drawer by themselves. Okay. It just becomes recontaminated. It's not clean, it's just recontaminated. And I know that's a thing that even I've done it before. Working in a salon, we wash our stuff and then we set them all neat in the drawer, but that was not right. Okay. Dirt was easy to accumulate on them again. We were supposed to put them away in a dry, sterilized, air clean, dry, sterilized container or Ziploc bag. Looking at our nail diseases, okay? Onychosis refers to natural nail deformity, which means the nail shape is, something going on with the nail shape, the way it looks, the way it's structured. So onychosis, okay, refers to any natural nail deformity. So onychosis usually refers to nail diseases, okay? With nail diseases, you are going to wear gloves. You have nail melanoma. This chart 6.2 is a great overview for you. Please make sure you review that. Nail psoriasis, they roughness and dryness. Onychia, okay, is your major inflammation. This is where the nail originally regenerates. So that means somewhere up in here, there's an issue, and it produces these type of nails. Okay. Onychocryptosis, okay, is ingrown nail. Onycholysis, all right, is the nail is starting to separate, but you are starting to see um, sometimes you can see the healing of whatever's going on in the body. You can see it in the nails. It is healing due to injury. And this sometimes can come from just jams in your hands, just jams, okay? And the nail plate just starts to separate. It could take up to 6 months for the nail plate to come back in. Okay. Onychomathesis, all right, it's the falling off of the nail plate. It's a medical procedure. Sometimes it could be the cause for chemotherapy or something of that nature. So it is also outside of our scope of practice. But when we see this, we just need to make sure it's acknowledged and discussed. Onychomycosis is a fungal infection of the nail. Okay, you can see it yellow streaks, darkness. The nail may crumble. It just may not be a nail before. So onychomycosis. Okay, paronychia. All right, bacteria inflammation of the tissue around the nail plate. So the nail is swollen. Could have any of those signs of infection. Making sure you do refer this client to a medical professional. Okay. Pseudomonas is contagious bacteria that cause infection. Okay, many times we see this yellow-green, and it can accompany ringworm. It can accompany onychomycosis. Can have a foul odor as well. Okay, um, can also just have a sticky feel to it if there's pus present. Algenic glaucoma. Okay, this is what some individuals will look at as well and see if there's an issue. I will look at the other parts of the body, the skin, the feet, as well the arms to see if and ask questions related. Does this person have any skin diseases? Does this person have you ever dealt with cancer? And things of that nature. So this would be a red flag for me to ask additional questions. Tinea pedis, fungal infections, athlete's foot, um, can come from dirty tools. Um, Please refer to a medical professional. No, we cannot do these in the salon. You can have red patches. It's very itchy, very dry, and sometimes very red and moist. Right, so we can see that. Nitrile gloves are recommended. It's my only glove of choice. I'm allergic to latex, but nitrile gloves have a little bit more stronger and they don't cause allergic reaction like latex or rubber gloves. Okay, so like this here. And of course, you have a little activity about the bowl disinfection. This is what we came here for, hand, nail, and skin analysis, okay? It's essential, as you notice, there's a common thread among hair, skin, and nails. You had to learn analysis for all of them, and you actually have a portion on your state board exam that talks about the analysis of the hair, skin, and nails, the disorders, diseases, and infections of the hair, skin, and nails, and the consultations of hair, skin, and nails. So that is why we have jumped over to nails because that is a part of your state board exam. Any client that comes in, there's going to be a conversation. Okay, you are going to use your wit, your wisdom, your knowledge to help determine the information that they're saying versus what you see. Once you put those two things together, you come up with a plan if you can service this client or not. And if you can, this is the plan that we're going to choose to go. It's what the client wants versus what the client needs. Okay. So even in this procedure of analysis, it says clean the hands of both the cosmetologist and the client. Tennessee state law states we are not to service any client before we wash our hands. Okay. How many times have you sat down and got a service and you did not see your stylist or your manicurist wash their hands? We're not talking hands sanitizer, talking about wash your hands. Okay. And again, there's protocol forms, rubrics for this as well. And we're going to look at that within our lesson. Scope of practice. Now, the law is created by the politician, but the board sets the rules for those laws. All right. So the board has regulations on what we can do, what we cannot do. And I know you've heard me mention this throughout the whole class. And I mention this all the time. The board really gives us limits on what we can do with our license. Okay. Even me, I can only license cosmetology, manicuring, lash specialty, natural hair instructor, aesthetics. I cannot do barbering because I'm not a barber and I don't have a barbering school. So the board gives me limitations as well, and it has done the same for you. Okay. Um, please understand what you're able to do with your license based on what state you're in. Every state could be different. You have a lot of states that are individual, and then you have a lot of states that are like national states. So it's like 4 or 5 states may have the same rules. Okay, Tennessee is moving towards something like that. But for right now, you will have to check with every state because Mississippi is definitely different from Tennessee. Mississippi may allow something that Tennessee doesn't, and Tennessee may allow something that Mississippi doesn't. Okay? Clearly, check out your state. Okay? And make sure you read that state law and what you're supposed to be doing with that. Um, as a licensed cosmetologist, you're able to really maneuver between nails, skin, hair. All right. You're able to maneuver between it. Make sure your license is always up to date and present with you. Okay. And then lastly, as we close out today, and this is what I'm going to say about everything we do, I want you to learn your terms. If you learn your terms, you will be able to answer any question that comes before you. Your ACE is stable. Okay. Learn your terms. The terms are going to help you this summer as you study as well, the month of July for your exam. But learn the terms. You have access to the portal. You have flashcards. Okay. You don't have to write your own cards. You can just go into that. You have sample quizzes. You have even sample exams. You have check-in questions. Learn the terms. Okay. Everything you need is at your fingertip. Plus, of course, on our YouTube channel, we have maybe almost 200 videos of live stream classes. When you're driving down the highway, put your class on. When you're exercising, put your class on. And then here, there's pronunciation after the term, so it helps you really understand how to pronounce the terms. Okay, you're growing. Today is Wednesday. Let's see. Tomorrow is Thursday. I'm probably going to send you a video Thursday and Friday. If you want to get on at 10, let me know for a study session. But if not, I'm going to send you a video for chapter 9, Principles of Hair Design. Okay. Chapter 9 and chapter 10. So, yeah. Friday, I think I'm gonna start my holiday. So tomorrow, if you want to jump on tomorrow at 10 for a study session, just text me. If not, I'm gonna send you a video for your first state board prep study guide. Okay, that's what we're gonna do for today. I'm super excited. Come to the end.